It's one of the most Catholic countries in the world, and the Philippines is deeply divided on a new law around reproductive health. The sexual education and healthcare law was pushed through by President Menino Aquino in December, but the Supreme Court has suspended it until after May midterm elections. Under a 1968 edict, the Catholic Church opposes reproductive health, and many villages and hospitals ban contraception. Filipino and East Timorese women have twice as many children and are over 30 times more likely to die during childbirth than their Australian counterparts. World boxing champion and Senator Manny Pacquiao is supporting church doctrine, while Broadway star Lea Salongo says religious rhetoric silences the death of women and children. Independent journalist and activist Cameron Walker has witnessed the division firsthand.
It was a very intense debate on both sides, both pro the RH bill and others saying it was going to be a terrible thing.
Mr Walker says the open dialogue does not mean free speech has been established under President Aquino.
Unfortunately, the political killings have continued. There still seems to be a climate of impunity.
But Mr Walker says the upper Senate's party list system and political culture is dynamic, brave and unpredictable.
There was a real aim to make the democracy more genuine. Party list groups seem to be a lot more vibrant and a lot more about fighting for a change. We've seen that over the past 30 years there can be sometimes very dramatic changes.
The country's largest contraception distributor, Phil Harvey's DKT Philippines, is focused on the idea that condoms and pills are marketable commodities and population control is a pressing humanitarian concern. But Mr Harvey funds his pro-condom message through Adam and Eve Porn Studio, which staunchly defends its right to make condom-free films and promote non-contraception sex in Western countries. DKT refused to elaborate on this contradiction, but for Jean Monte Humandas, the Gabriela Women's Party Public Information Officer, that hypocrisy is part of the problem. She says giving Filipino women cheap condoms and pills to stop them having children is different from giving them reproductive health care for their own well-being. Activist Amy Jewell says many Catholic groups support Gabriela's message against rape, violence, legal discrimination and the lack of reproductive health care. Amnesty International, an organisation with predominantly Catholic members, supports the RH law, according to New Zealand Executive Director Grant Belden.
While the law doesn't have everything we'd like to see in it, we still believe it's a historic milestone for the Philippines, especially for the poor and for people in remote areas who have the worst access to healthcare. Reproductive health rights are basic human rights.
The Philippines exists at a cultural crossroads. The debate around reproduction reflects Asian condom anxiety, American-style conservative morality, and broader discussion across the mostly Christian Pacific. Sami Subramaniam, the director of Family Planning International, part of the Asia-Pacific Alliance, says reproductive health is a complex but important issue. The RH Index, which the organisation uses, considers rates of chlamydia, adolescent pregnancy, maternal death and infant mortality. It also takes account of female schooling, modern contraceptive use, marriage age and access to safe abortion and midwife services. The Philippines Ministry of Health attributes its record high HIV rates in January to unprotected group sex between men. And the New Zealand AIDS Foundation spokesman Jason Myers says access to contraception and openness about sexuality is also essential to limiting the spread of HIV and STIs.
Adopting a human rights framework is something we're really trying to push. It's very difficult to capture the kind of country-level challenges and nuances.
While the reproduction discussion continues across the Pacific, the Philippines Supreme Court will decide where it stands on the RH law in June.